106 heads of state and ministers around the world have now, on the record, championed universal health coverage in speeches at the United Nations, reaffirming their intent to achieve health for all. Now it's our turn to send them a message. And this year's UHC Day campaign theme says it loud and clear: keep the promise. On 12 December 2017, the UN General Assembly proclaimed 12 December as International Universal Health Coverage Day, making it an official United Nations designated day. What does it mean for you and I? Dr. Anban Pillay is the Director General at the Department of Health, and he joins us now to speak about the day and South Africa's bid to achieve the goal. Dr. Pillay, a very good evening to you, and thank you very much for joining us.
Good evening to you and to the viewers.
So just reflecting back on that 2 years of that public launch of UHC Day. And I remember being there was much excitement saying, yes, we're finally going to get this off the ground, we've been working hard at it. But it's sad that sometimes events like this seem like just a day.
Yes, I think there's been a lot of effort in trying to get UHC going across the world. In many countries, the big challenge is obviously to get the financing right, because UHC is largely dependent on mobilization of finances. The G20 has made a lot of effort in trying to get finance and health ministers together so that the finance ministries can understand that the importance of funding healthcare, because it's intricately linked to economic growth, and if the population is not healthy, you obviously will not get economic growth because they would not be in a position to actually be productive.
But I'd imagine that much like the MDGs and now the SDGs, there's a big importance that should be placed at least on country context in those global strategic partnerships, even if it does come with aid.
Yes, so certainly you see now many of the donor partners as well talking about UHC as a key part of their support to countries. So they're simply not saying we're going to be providing with financial support. They're also looking at how countries are going to be adopting UHC in terms of making sure that they become self-sustainable.
And how, obviously, it's a global goal, and yes, going back to the whole thing of country context, even if we're looking at health for all from a continental perspective, some countries are more vulnerable than others, especially post-conflict, for instance. So yes, the systems are compromised. What is our biggest challenge as South Africa?
Our biggest challenge is, I think the financing of the health system. It's obviously, we're in a period of slow economic growth currently, so we need to see how we best mobilize funds to do that. And our second challenge is really that the quality of care in our public health system has to improve significantly in order for us to build the confidence about the UHC program, which we call National Health Insurance here. And I think that's going to be the greatest effort that we need to make in the short term, to make sure that we can develop a public health system that's of high quality that all citizens can be confident about.
As you say, equity, especially in a country like South Africa, yes, has been the biggest bugbear. But strengthening our health systems alone, some people have said the approach is a bit problematic because as much as it wants to amalgamate the two, there seems to be a great deal of focus on a private healthcare system as opposed to the public healthcare. And I know there's a bit to change that with the NHI, but yeah, is it enough?
Yes, I think the narrative has been largely about the private healthcare system, but I think we need to reflect on the fact that the public healthcare system provides care to 84% of
yes,
the population. And in an NHI system, if you simply said, okay, all South Africans will access care in the private system will never be able to deliver that service anyway. So the backbone of the NHI has to be the public healthcare system. The private healthcare system will be there as well to support and complement what the public healthcare system is doing. But I think trying to build the public healthcare system does require an intervention on the private healthcare system side as well.
So let's talk about that, because as you say, it's not necessarily undue focus, but there's a lament of a lack of clarity in the lines of command, even as you propose this. And I also want us to talk about the distinctions between universal healthcare coverage and NHI, because I think some people tend to conflate the two.
Yes. So on universal health coverage, I mean, it's a broad term which covers various models of healthcare financing and delivery. In South Africa, we've taken a particular approach about how we want to finance and deliver that, and we're calling it national health insurance. So in the UK, for example, they call it the NHS. Each country has its own structure based on where its health system was when it started, and what are the financing system structure of the country, etc. So I think each country will do that based on what its structure is currently, its finances and other factors. And we've developed the NHI, which we think is the best way for us to do
It's the best way, but it's not the only way to be able to achieve universal healthcare coverage. So I'm just trying to understand from a government perspective, what else are we doing to strengthen our systems? Because it's also about sustainability, but resilience of those systems.
Yeah, so I think it's important that we build a strong system now, even before we implement the NHI, particularly around efficiencies, around costs, around production of health professionals, and making sure that the system is geared towards delivering high-quality services. That will be critical for us to be able to implement a sustainable system. So it can't just be because we're implementing NHI, it's got to be there for the life of the system.
And just, you spoke about funding being our biggest challenges, but they're also structural in terms of the differences between rural and urban.
Yes.
If we look at also just shortage of staff, whether it be doctors and nurses, etc. But there's also attitudinal gaps in terms of implementing UHC as a goal.
So I think the urban-rural divide is there globally, and there are some levers that one can use to, or policy levers, I mean, to be able to influence that and breach some of those issues. On the issue about attitude, for example, in the public sector, the problems with attitude are largely linked to the workload and the working conditions. Under an NHI system, we would hope that the quality of the service will improve, largely because waiting times will be reduced and the workloads for professionals will be reduced quite significantly, which would then improve attitudes as well, because you can imagine a health professional having to see 100 patients, and they're probably exhausted by the end of the day, and so attitudes are linked to those kinds of things. So I think we need to link this to the service delivery platform.
But are we any close? Because we hear lots of harrowing stories, not only from individuals, but from activists as well, that while we speak this language, we're not really walking the talk, because we're not treating individuals as people. So if we're talking about UHC, are there policies in place that still deal with people at an individual level, irrespective of race, gender, sexual orientation, economic strata, etc., but also from a health perspective?
Yes.
Is there streamlining of?
So one of the key things in the NHI policy is that patients will choose their healthcare provider at a primary care level. And so in doing so, they would obviously make judgments about the attitudes and the way they're being treated by the healthcare provider that they've chosen. And clearly, if they're not happy with the service with that provider, they may move to another facility. So this changes the dynamic that currently exists, because in the current public health system, you usually would access care at a particular facility, and whether that provider provided good or poor care, you were trapped to that particular facility. With the NHI, you could move to another facility, and the funds would move with you. And so the people in the facility that are providing a poor quality service will learn very quickly that people are moving away, and this is going to affect
because
us.
it still makes my blood boil to hear of the maternal deaths or newborn deaths arising out of somebody being refused care, or being kept waiting for hours in a reception room because details, all of those things that, at a very basic level, I think shouldn't happen.
No, certainly not. I think that, as I said, this is workload one, but I think the second issue very clearly is that if patients are going to have choice, as they do in the private sector, if you don't like your doctor or your facility, you move somewhere else. In the public sector, currently, you're generally not able to do that. So I think that with the NHI system, when we change the incentives and say that patients can choose, it's then going to change the behavior of professionals in the public system, because now they realize, well, this person's not trapped with me anymore. They can actually move to another facility, and that's going to actually affect the way I'm able to deliver service in this facility.
Okay. So just a quick and final question, Dr. Pillay, the health symposium at OR Tambo that's taking place today, how does it move this conversation further? How does it improve our health systems?
So the symposium that we had, we basically brought together a range of sectors: civil society, labor, business, academics, etc. And we brought them together to try and hear what their views are about how we take UHC forward, where we are currently with the NHI, and how we include everybody in this process, because this is a collective effort that the country needs to move towards the universal health coverage.
But are there tangible outcomes? Because having multi-sectorial dialogues are important, but at the end of the day, if the input is not put in practice, as in from that multi-layered perspective, how good is it?
So we have a set of indicators with clear time frames linked to that. So we're working with the stakeholders and sectors to understand how best we'd be able to implement that, with clear indicators about timelines, etc., about how that will happen.
All right. Thank you very much for your time and sharing with us your insights. Dr. Anban Pillay is the Director General at the Department of Health.